Hi guys, I'm back. It's your true crime nurse. I am here to go over the autopsy results from Mecklenburg County here in North Carolina. The second autopsy that was done on Shanquella Robinson. I am going to get into it. Also, I'm just going to put up this disclaimer here that this is fair use. Information mentioned is alleged, and we are covered by the Copyright Act for fair use. Okay. So let's get into things here. Share my screen and see, I wish I could exit out of here. Okay, let's go back here. And then, okay. I'm trying to zoom in. See if I can see it here. See this part, I wish I can get off that one. See. Oh, here we go. This here on the side. I wish I can get that off. I just want this. Yeah, and what can I do to?
If you're in Safari, you could put it in reader mode, but you're in Chrome.
Oh, what can I do to? Can I zoom this in on a Mac?
Command plus something.
Let's try it. Oh, all right. There we go, guys. Hope y'all can see that. Okay, so. This is Shanquella Robinson's autopsy report here. As you can see the title, this is for Mecklenburg County. Okay. Here's the address. Shanquella Robinson. They did this on November 17th at 9 o'clock in the morning. Cause of death is undetermined. And see summary and interpretation section. And we got the forensic pathologist is Thomas Owens. And it looked like the final report just came out today, according to this. That's really odd. If they did it in November, December, January, February, March, April. Whoa, that's a long time. Okay, the descendant is a 25-year-old female who, by reports, was on vacation with other persons and friends in Cabo, Mexico, where she was reported to have been heavily consuming alcohol. And then let me just stop this, guys. They also have talked to Cabo 6, the FBI. So let's see what's going on here. Where she was reported to have been heavily consuming alcohol on 10/28/2022, continuing into the early hours of 10/29/2022. She was also assaulted on the morning of 10/29/2022 at approximately 7:30 a.m. local time. A portion of this was captured on cell phone video. She reportedly went back to her room or bed following the incident. There's no further information available on her condition until she was discovered shortly before noon, lying face down on a bathroom floor by housekeeping, who notified her friends. At around 2:15 p.m., the friends requested medical care for her, reporting that she had consumed too much alcohol and needed hydration. Shanquella was evaluated at the residence by a doctor around 3:15 p.m., who found her to be minimally responsive and clearly dehydrated. During attempts to place an IV for hydration at the residence, she went into convulsive crisis, followed by complete cardiopulmonary arrest at 4:49 p.m. Multiple rounds of resuscitation were unsuccessful, and she was pronounced deceased at the residence at 5:57 p.m. She underwent a minimally invasive examination, partial autopsy, in Mexico on the morning of 10/30/2022. Her body was then returned to the United States. Her death certificate listed the cause of death as severe spinal cord injury with atlas luxation. On 11/16/2022, I was contacted by CMPD Detective B. Fitch on behalf of the FBI and asked to perform a complete autopsy examination in order to determine her cause and manner of death. The body was transported from the local funeral home to the Mecklenburg County. Hold on, guys. So on 11/16, I was contacted by the detective on the behalf of FBI. Oh, so the FBI asked him to do this autopsy. Interesting. The body was transported from the local funeral home to the Mecklenburg County Medical Examiner's office for autopsy examination on 11/17. Please see the report of investigation by medical examiner for further historical details. Yeah. Autopsy examination reveals the embalmed body. So, I'm just gonna hold on, guys. I just want to say one thing. So, if the plans were to have Shanquella receive a second autopsy because you think things are suspicious from Mexico, because that would have been automatic. You could have done it before embalming the body. So with family and everyone knowing that, hey, something ain't right, because by the time her body got there, they found out about the video. As for what Mr. Robinson said on a interview, that while he was there getting prepared for her funeral, that's when Girl told him about the video. So they found out the video was surfacing. When was that? November 15th, 16th. So her funeral was what, on the 19th? No, it had to be. No, they had it. I have to look up when her funeral was, because by the 17th she was already embalmed. So, anywho, just something to think about. Okay, so the autopsy examination reveals the embalmed body of a young adult female who has undergone prior partial autopsy examination with a sutured frontal scalp incision extending coronally from ear to ear along the hairline. What was her funeral? Okay. So they must have her body already embalmed, before the funeral. There's also a suture vertical midline incision extending from the neck just above the pubis. Further external examination reveals several areas of linear and geographical abrasions on the abdomen. Hold up, guys. I'm sorry, this is my first time reading this. There's also a sutured vertical midline incision. Further external examination reveals several areas of linear and geographical abrasions on the abdomen, pelvis, legs, and arms, as well as a focal abrasion with bruise and underlying subgleal hemorrhage on the forehead. Abrasions are noted on the right cheek area, and there is a scleral hemorrhage in the right eye. Internal examination reveals evidence of a prior minimally invasive autopsy examination. Upon opening the scalp, there is prior post-mortem removal of a portion of the calvarium for access to the cranial cavity. The removed bone fragment has been returned to its original position. Removal of the calvarium bone fragment reveals disruption of the dura, and the brain is present in a clear plastic bag. Oh no. Yeah, hold on. Further examination reveals that the brain was transected from the spinal cord just below the brainstem. Examination of the dura reveals a small amount of crumbly, solid, reddish-brown blood material in the left posterior fossa and adherent to the inner surface of the dura. No skull fractures are present. Examination of the body cavities reveal that the chest cavity has been previously accessed with bilateral vertical cuts through the costal cartilage of the ribs just lateral of the sternum. Upon opening the chest, the larynx is found to have been transected just below the hypoid bone, and then a second transection through the trachea at the level of the sternal notch. So they're just talking about all of the things that Mexico did during their autopsy. So these are different cuts and things, and they're just describing where it's located. This section of the upper airway is found lying within the approximate anatomic location. There's no evidence of injury to this upper airway section, and no hemorrhage in the surrounding neck muscle or fracture hemorrhage of the mid-lower cervical and upper thoracic vertebral column. That is very important. So it says, upon opening the chest, the larynx, which is that's your like throat there, is found to have been transected. So a horizontal transection just below the hypoid bone. So right there by your collarbone there, a little bit of that, and then a second transection through the trachea at your windpipe, right there by your throat, at the level of the sternal notch. Your sternal notch, you got a collarbone, and there's a little divot there that's considered a sternal notch. Okay, so this section of the upper airway is found lying within the approximate anatomic location. There's no evidence of injury to this upper airway section, and no hemorrhage in the surrounding neck muscle or fracture hemorrhage of the mid to lower cervical and upper thoracic vertebral column. So the cervical area is where they said that there is injury, that there's a fracture. They don't see any of the surrounding neck area having a fracture or any hemorrhaging. So if there was a cervical fracture there you would see something there. They would see something when they're looking at, according to their examination. Because what did they say? She was a sub. No. In Mexico, they said it was a
sublux.
The subluxation.
Yeah, subluxation.
So they're not seeing that atlas luxation.
Yeah.
So Mexico said there was an atlas luxation. That was the second area of the cervical bone was fractured with a spinal cord injury. So far up there by the neck, there's no fracture, no hemorrhage. The hypoid bone is intact. Further examination reveals that all the organs are in their correct anatomic location, and the pericardium has been previously opened. Typical of an embalmed body, the organs are bloodless and firm, and there are trocar defects present in the heart, base of the lung, stomach, liver, bowels, and kidneys. The organs have not otherwise been previously removed or sectioned in any way. Removal and sectioning of the organs reveals no evidence of other trauma or disease process. So this is why they're saying that it's a partial autopsy, because when you have a full autopsy, you got to look at all the organs. And if they didn't remove any of the organs to look at them, I guess we can deduct that they did a partial autopsy. Okay, removal and section of the organs reveals no evidence of trauma or other diseases. The lower trachea and bilateral main bronchi are obstructed with semi-solid, crumbly blood-like material and possibly food consistent with vomitus. So they said she threw up, and they found it in her body. There are no fractures of the rib or the remainder of the vertebral column. Slight lateral scoliotic curvature is present and the upper to mid thoracic spine. A posterior neck dissection is performed and there's no evidence of hemorrhage or disruption of any musculature, ligaments, or the spinal elements. No fractures are seen on the posterior of the spine column. There is no evidence of any disruption of the spinal column alignment or subluxation. The brain, dura, and spinal cord are sent for neuropathology consultation. Please see the report. Post-mortem blood testing performed in Mexico does not reveal the presence of any commonly abused drugs. Test of ethanol drinking alcohol was reportedly performed, but was not listed in the report. The ethanol results was later verbally reported. Discussions on 4/3/2023 with officials in Mexico as negative. No urine, vitreous, or samples were obtained during the original examination. No blood, vitreous, or urine was available for collection at the time of this autopsy. A separate toxicology report, translated copy, attached at the end of this report for details. Okay, so now that the body, what happened is the FBI got involved. They automatically requested to do an autopsy, but the family had already prepared to bury her, but the FBI still said, no, we can still do an autopsy, even though that she's, you got her embalmed and ready, we're going to still do this autopsy. So there's certain things they can't get blood, they can't check blood levels for toxicology, so they have to go by Mexico's toxicology. So there was a toxicology done in Mexico.
Okay.
They tested for ethanol as drinking alcohol, and that was reportedly performed, but was not listed in the report. So they tested her alcohol, but they didn't put it in the report. And later on, the ethanol results was later verbally reported. Discussion on 4/3/2023 with officials in Mexico as negative. This is odd.
Yeah.
They didn't test alcohol after the friend said it was alcohol in Mexico, but they called United States on the 3rd of April, just the last week, and told them, oh, we're going to just give you a verbal. It was negative.
Yeah. Wow.
So that report, her alcohol level was purposely hidden off of the toxicology report.
Yeah.
This is interesting.
Wow.
All right, in my mind is already rambling as to what I think is going on, but I will not say that publicly here. No urine, vitreous, or other samples were obtained during the original examination. Why would you not obtain any samples from that body if you're doing an autopsy? Why did Mexico only do a half autopsy report? And why was this autopsy shoved in our face that she had a broken spine if you didn't do the full autopsy while you were down there? That's the first thing I would want. Please show that my daughter didn't have no alcohol in her system, and they lied. Why was that not? Why was that not listed on the report?
Right.
Please see separate toxicology report. At this point, and I'm just gonna say, Cabo 6 might be getting attorneys at this point, because if you're saying that I lied about the story, but you don't have proof that I lied.
Yeah.
You got to prove that I lied. You got to prove that what I told you that it was alcohol poisoning is a lie. How can you prove that if they didn't do the alcohol test and it test her for alcohol?
Right.
That's crazy.
Yeah.
Based on the history and autopsy findings, it is my opinion that the cause of death in this case is undetermined. The most significant findings at autopsy are the hematoma of the forehead, the mild cerebral edema, and the hypoxic ischemic brain injury. The hematoma of the forehead is consistent with blunt force trauma. The mild cerebral edema is a non-specific finding. The hypoxic ischemic changes to the brain are consistent with several hours of obtunded survival with inadequate blood flow oxygenation of the brain. That means that they were doing CPR. Oh no, I'm sorry. No, they're saying that she had some lack of blood flow in her brain due to her not having good oxygenation. So whatever that happened to her, she had some issues with her blood flow and for her brain to get the appropriate blood flow and oxygen that's needed. So that's why it was hypoxic, means low oxygen, and ischemic, meaning that there was like the arteries were blocked where she couldn't get in enough oxygen. Okay. Yeah, so it's like it's not due to underlying disease or anything. It can be caused by, you know, a certain trauma or basically just not getting enough oxygen. You can get ischemia because build up or blockage in your arteries. So it could be a little small blood clot there that causes ischemia, and then she's not getting enough oxygen to the brain. So review the report of the examination performed in Mexico and discussion with Mexico ME pathologist on 4/3/2023. I don't understand why they just are talking to the Mexico toxologist on April 3rd. Confirms the original findings of a forehead hematoma, mild cerebral edema, no significant intracranial hemorrhage, and no evidence of brain herniation due to the limited nature of the prior examination. The spinal cord and cervical vertebrae and ligaments were not directly visualized. Wait a minute, y'all. Oh, shoot. I mean, went up too far. Hold up, y'all. I'm sorry. Okay. Review of the reports of the examination performed in Mexico and discussion with the ME. Okay. No significant intracranial hemorrhage and no evidence of brain herniation. Due to the limited nature of the prior examination, the spinal cord and the cervical vertebrae and ligaments were not directly visualized to confirm a suspected subluxation disproven by this autopsy. Okay, so due to the limited nature of the prior examination, the spinal cord and the cervical vertebrae and ligaments were not directly visualized to confirm a suspected subluxation. While the reported postmortem blood testing results of ethanol was negative, the time interval between when she was involved in the assault and the time of her death was approximately 10.5 hours. Is sufficient to allow for metabolism for any alcohol that may have remained in her system that morning for consumption the previous day and night. So what they're saying is that although the test is negative, there's a time interval from the time that Dejanay had gotten a fight with her until her death at 5:57 time. Okay. They're saying that 10.5 hours is enough time for that alcohol to be metabolized in her system. And that is why the alcohol is showing up negative. So it's not showing up negative because they're for sure that she did not have any alcohol in her system. It's because the timing of when they checked her blood levels. Because if she was drinking the night before, she got in a fight at 7 o'clock in the morning, she was drinking that morning, and then she got in a fight at 5 o'clock, and then they didn't do the autopsy to what that next day or morning, that was 10.5 hours or more. And so by that time, the alcohol would have been metabolized. They would have had to get and check alcohol samples, which is, if your friend called and said, hey, she's here with alcohol poisoning, it's important that they should have got them alcohol samples probably like when they arrived at like 2 o'clock that same day for us to get an idea. So right now, you can't prove that what the kids said, I won't call them kids, but what Cabo 6 and them said is false because we don't have any evidence to prove that she wasn't drinking. But we do have a video with her holding up a drink saying drank. So they're gonna take, just like they want us to use the videos for a conviction, they can use the videos to prove other things too. So it's a double-edged sword with that, right? Okay, so basically, they don't see any spinal cord injury, and there was too much time that went by, and that's why Attorney Sue Robinson was saying justice delayed is a what I forgot how she said it. Justice delayed is justice not uh, given or something. I forget how she said it, but basically, justice delayed means justice not served or something she said like that. The reason why there will be no justice because of justice delayed is because look at all this time that lapsed. And as you can read this autopsy report, hey, we can't even get a good alcohol sample on his toxicology because they waited too long. So their results is null and void because they waited so long to get them. It is also not known if she consumed any additional alcohol following the assault that morning, which was also metabolized before she expired later that afternoon. So they're saying if she had a drink that morning, they wouldn't have known because by the afternoon time, it would have been metabolized, and they didn't check her till after that time. There is the potential contribution of blunt force head trauma causing cerebral edema or a concussion. So them kids are probably going to say she fell in the bathroom and hit her head. Persons with a concussion would be expected to initially exhibit persons with a concussion would be expected to initially exhibit an altered level of consciousness or even unconsciousness immediately following the head trauma. Shanquella's level of consciousness immediately following the fight is not clearly documented. Although she was able to return to her bedroom and bathroom area, it is also not known if she may have fallen and hit her head in the bathroom, what did I say? Where she was discovered lying on the floor approximately 4 hours later. The possibility of a post-concussive apnea diagnosis cannot be excluded. So they're saying that the evidence show that it can also be that they got in the fight, she went in the bathroom, and because the maid stated that she did find Shanquella on the floor and told her friends that she went in there and hit her head, and that blunt force from her hitting her head is what caused a concussion. And then she had basically a concussion, and it's called post-concussion, meaning after hitting your head, you get some swelling up in there, swelling tissue, blood collecting there, and it causes apnea, a lack of oxygen, and that can cause her consciousness to be limited and her level of consciousness to change. Okay. The possibility, okay, I read that. Shanquella never made it to a hospital prior to her death, and no vitreous fluid was collected or available for testing post-mortem. So by her staying in that house with them doctors working on her for 3 hours also has created barriers for justice because she should have been transported straight to the hospital. So for whatever reason why them doctors didn't want to speak to the her family and the person closest to them to figure out what to do, I don't know. I don't know why they were okay with taking taking any type of like rules or any type of commands from your boy Khalil. Like why was he able to give orders and to tell them what to do? Why didn't they say, hey, let me speak to the next of kin? But anyways, therefore, the extent of her dehydration, potential electrolyte abnormalities secondary to acute heavy alcohol use and contribution to her death is unknown. So they cannot prove about her electrolyte imbalance due to her acute heavy alcohol use and contributions to her death. They can't prove that at this time because she did not go to a hospital prior to her death, and they didn't collect any fluid. So that's how you are able to tell an electrolyte imbalance if somebody is dehydrated is by blood samples, urine samples, none of her fluid or vitreous fluid from the spinal cord. But because they waited so long, and what time they said they took the body out, that 9 o'clock that night, she died at 5. I mean, yeah. The diagnosis they have here is bruising in the center and right side of her forehead and subgaleal hemorrhage, bruising of the forehead, abrasions on her right cheek, just inferior of her eye. She had a brown scleral, I can never say that, hemorrhage in the lateral aspect of the right eye. Several superficial linear abrasions present on the upper and lower aspects of her arms, both arms. Bruising located on the right medial forearm and posterior right forearm. Abrasions of the posterior right hand and thumb. Pattern horizontally oriented abrasions extending across the lower abdomen and around to the right flank. Multiple irregular geographical abrasions along the bilateral lower abdomen and upper interior thigh. Multiple irregular superficial abrasions of the right hip and right upper thigh. Multiple linear and abrasions. So just a lot of abrasions on her legs and on her ankle. And I'm just going to kind of go through here. You guys can kind of see it. And then they got previous postmortem examination and embalmed body with absence of intravascular blood. So they put sutured incisions and all the stuff we talked about there. No blood or urine or fluid was available. Lower trachea and bilateral main bronchi obstructed by vomitous material. She had some low oxygen in her brain, some bleeding in her brain. She had some hemorrhaging in her spine by her chest. Toxicology results negative. Ethanol testing results not in report. Verbally reported as negative. Okay, so she's 131 pounds. She's embalmed. Eyes. The body is received unclothed. No items accompany the body. Then they got her descriptive marks. They talk about the incisions, the abrasions. All tattoos and scars are recorded on the body. There's no evidence of any recent medical intervention. An identification tag is on her right ankle. Okay. Each earlobe is pierced with no jury present. Fingernails and toenails cut with white polish, which is uniformly chipped off along a straight line at the end of all of her fingernails. Nail clippings reported taken at first examination. A small amount of black possible ink is identified under one or two of the nails. Wow. So she has injuries here. So she has an abrasion on her right forehead and some bruising, some blood under her scalp, right anterior cheek area below the eye. She has a scratch there or an abrasion. The right eye just lateral of pupil is she has that brown color hemorrhage. And with that being brown, that leads me to believe that by the time, well, of course, when they seen it, it was old. But I wonder what color was Mexico's, if it was red or pink, because brown is meaning blood has sat back there for a while. Oh, yep. No petechiae, which means like little blood pieces of blood. They look like chicken pox, but red marks where the injuries are present to the eye, look like little blood clots. Her left eye is fine. They didn't see any fractures on her skull. Just a little bit of crumbly blood material that was left in her head. And her chest is fine. There's no injuries there. On her stomach, there's abrasion with multiple vertical oriented. So basically, there's some abrasions, and they're irregular abrasions on her stomach, and you can kind of see on here the size of them. There is on her abdomen, on her right lower back, there's abrasions, and I'm just trying to. All of this is just telling you exact locations, so I'm just trying to generalize this. On both sides of her stomach and groin area and upper thighs is multiple irregular scratches there. That's wow. And all those scratches extended onto the left side of her hip. She has some scratches on her left hip area. Her right hip has multiple 7 to 8 irregular superficial abrasions. She got all these scratches on her body. That's on her right upper arm and her elbow, she has some abrasions there. Position from the elbow is horizontally. Right around the elbow, there's some more abrasions. Her left forearm, right below the middle part of her arm, is some bruising and abrasions. There are 3 superficial abrasions on her right elbow and upper forearm. And then her right forearm area in a diagonal orientation, there's some bruising there. On the posterior right hand near her wrist, 1/8 inch round abrasion. On her right thumb, on the lateral aspect, there's an abrasion. It looks like, were they like taking something, scratching her body? All these small abrasions, like somebody scratching you. Examinations of the left arm reveals no injuries to the anterior surface. Located just below her shoulder, her left arm has another linear abrasion. All these abrasions, that mean when they say linear, that's a straight scratch. And an abrasion is a scratch. Located slightly below the abrasion upon the other examination appears to be a pigmented skin lesion on her left arm. On the posterior left forearm, below the elbow, there's another abrasion. Located 3 1/4 inches below the elbow is a 1/16 inch dot-like abrasion. There is a 1/8 inch by 1/16 inch superficial linear abrasion located slightly further down, 4 1/4 inches from the elbow. And then there's a 1/4 inch long healing linear abrasion is present on the posterior left forearm, 6 1/2 inches below the elbow. located on the bilateral medial aspect of both thighs. So we're talking about both of her thighs and the inner part of her thigh. There's multiple linear and curved linear abrasions, which are present in multiple directions. They measure about a 1/4 inch to 2 1/4 inches in length. Wow. So inside her thighs are abrasions. What the heck? What happened? Yeah. And curved linear basically is basically bounded by curved lines. So the lines, they tend to curve. So she had that as well. Um she had an abrasion just above her and lateral to the right knee, vertical oriented and linear. And then her left ankle, on the outside of her ankle, outer part of her ankle, she had a reddish brown abrasion with 2 adjacent smaller abrasions measuring then 1/2 inch above the posterior to this 3/16 inch of irregular abrasion. The internal organs show evidence of damage from the trocar used in embalming, specifically the heart, base of lungs, stomach, liver, bowel, kidneys, but are otherwise unremarkable. So that's normal for embalming fluid. It causes some damage there. No fractures are present to the ribs or the vertebral column. So her spinal cord, no fractures there. Okay, guys. So this is basically the body cavities they show. Kind of what we already went over. And her heart, they looked at it. Everything looks unremarkable for the cardiovascular system, which is good. Respiratory, they talked about that earlier, that there was a small amount of blood there inside of her trachea area, which it was possible partial food particle. They did a histology. So that particle that was stuck in her food, they did a histology, and the histology is taking like basically almost like a closer look at that particle, and they're going to look at that under the microscope to study the tissue to find out what type of tissue it is. Tracheal and bronchi, so her neck, her airway there looks good. She had some congestion in her lungs, a little bit of edema. Pulmonary arteries was fine. Her stomach is fine except the trocar injuries. The stomach was empty. The bowel was fine. The liver was good. The focal bowel staining of the liver did. Her bowel tree is patent, and all her organs is good. Her spleen, her pancreas, her urinary, her reproductive is fine. Endocrine. Her neurological area, there was a small blood clot there they got here. Some cerebral edema. There's no obvious trauma or hemorrhage involving the brainstem or the spinal cord. They got that in here again. The immune system was fine. Muscular system. A detailed posterior neck, upper back dissection reveals no evidence of hemorrhage or disruption of any of the muscles or ligaments, and no injury or misalignment of the cervical vertebral column. The upper to mid thoracic spine shows a slight internal scoliotic curvature. And that could be from a previous accident. They did an X-ray. They did a full body X-ray. They looked at the front and the back and the side of her. The images revealed that there are no evidence of fractures or foreign body. The prior post-mortem examination defects in the cranium and the chest are apparent on X-ray. Then they talk about, the pancreas. Oh, okay. And they even get pictures here. So here's all of the abrasions that I was reading off. So we have a sutured incision there. We can see all of the abrasions there. Yeah. A lot on her arms, like almost scratches or cuts.
Yeah, cuts, small cuts or scratches.
Wow. Wow. Here's they got it even lateral. This is considered lateral version here, y'all. The left and the right side of her. These are a lot of abrasions by her stomach. And there's so many tiny abrasions. You know, this fight that they must have been fighting prior to that morning. All them scratches.
Yeah.
This is the laboratory results report. And as you can see, this is more of a thorough autopsy. Look how long it is from compared to that stuff we've seen with Mexico. A lot of stuff either wasn't done or we didn't see it. Final diagnosis, hypoxic ischemic brain injury, focal subarachnoid hemorrhage, left frontal parietal lobes, focal subarachnoid hemorrhage, thoracic and spinal cord. So basically, a blockage to the brain and low oxygenation to the brain, and right around her spinal cord and her lobes to her brain, there was some hemorrhaging, there was some bleeding going around there. And these are things that can happen with a fall. I worked in a nursing home in the beginning of my nursing career. Whenever our elderly patients fell, even if they were okay and talking, and we did a neuro exam and asked them where they are, check their blood pressure, asked them some questions, check their pupils and stuff like that, had them follow a couple commands, even if their neuro exam was unremarkable or it was intact, you are still going to send that patient to the hospital for them to get an x-ray and all that stuff to make sure that there's no issues, because you can have a brain injury that you don't know about till later from a fall. And so they're just talking about the brain and all that. They get really in detail of the organs. and look like they took specimens. This is the toxicology report from Baja, California. And then, as you can see here, a note: no ethanol results listed in the report. Video conference on 4/3/23 with Emmy and other persons in Mexico, including lab. Ethanol was tested, but no results were included in report. Ethanol reported negative. They spell her name wrong. They spell her name Shanquella with a K. Okay, let's look at the toxicology results. No drugs in her system. All right. So that's it, guys. Wow. Let me take that off. We'll stop sharing. Okay, so that took a while for me to go through that. Those autopsy results. Basically, to sum it up, they did not get the body in enough time. By it being embalmed, you can do an autopsy with an embalmed body. However, there are certain things you just won't be able to get to and access. The toxicology report and things is based off of Mexico, and I don't believe anything Mexico say at this point. I don't know about you guys. They don't seem to be a reliable source. I don't know how incompetent a person. I just don't know how incompetent a entity could be to do an autopsy and don't put alcohol in there, and that's supposed to be the main cause of death, and you didn't include it in the report. That is kind of odd to me that you would leave that off of the report, and this had to be something that they took verbally over the phone 6 months later. Whenever there's a crime scene, it's important that you're on the scene right away, looking at things and collecting evidence, because the longer you wait, the worse things are, and you're not going to be able to prove things that there's no evidence. So at this point, in my personal opinion, I feel that the results are basically inconclusive, because we don't have everything. Time waited so long. There was time in between. They did an autopsy of an embalmed body. United States couldn't even run the drug test. So her friends are saying alcohol poisoning. We don't have any substantial evidence to prove that it was not alcohol poisoning. So we would have need an autopsy result with alcohol in the results. So I don't know why that wasn't in there. Is just something sketchy with this case? I think there's something real just eerie with the case, and there's people involved in doing things behind the scenes, and that's being covered up. So in my opinion, the Cabo 6 will not be extradited, because the United States will have to agree to that. And common sense, they're saying there's no evidence. They're not going to agree to send them to Mexico. So they're free on that end. The only option is for Shanquella's family to start suing people on a civil case. However, with Cabo 6, on that guest list that they signed, there was a bill of law saying that travelers take a risk of being over there. So it would be, I'm curious to know what the other forms were that those kids signed, because they signed that stating that they understand that. If you read the words up there on the guest list, it says that. So you might want to take a look at that because they might have signed away their rights on that. So I don't know how much the Robinsons will be able to sue the owners of the villa. I did call the villa, and they said that they don't have cameras on every villa, and you can have visitors come there to visit you, and after the fact. So, in the rules is basically dependent on the owner of the villa, and there's various different owners of those villas. So I think there's 2 to 3 different owners, but it's not just one person that owns all the villas. So anyways, leave a comment and let me know what you think about those results in comparison to Mexico's. I gotta go watch 54 Keys coming on at 9 o'clock. You might want to tune in. All right, guys, catch you later. Goodbye.